Why some cosmetic treatments age the face faster. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. Why some faces look overfilled, and why it is not always just too much filler. This channel provides evidence-based education on cosmetic medicine, injectables, lasers, and skin science. One of the biggest misconceptions in aesthetics is that overfilled faces happen only because somebody injected too much filler. The reality is usually far more complex. Filler itself is not automatically the problem. The problem is often poor assessment, poor planning, poor understanding of aging, and repeated treatment without reassessment. One of the most common mistakes is treating lines instead of treating the face. A fold or hollow may not simply be a volume problem. It may be caused by tissue descent, ligament laxity, fat compartment changes, or skeletal aging. If we repeatedly fill every visible line, without understanding why the line exists, the face can gradually become heavy, wide, puffy, and unnatural. Many patients do not suddenly become overfilled overnight. It usually happens slowly, over multiple treatments, across many years, sometimes by multiple injectors. Another major issue is failure to reassess the face as the patient ages. The face changes continuously, bone structure changes, ligaments weaken, fat compartments shift, skin quality changes. A treatment plan from 5 years ago may no longer suit the patient today. This is why experienced injectors do not simply repeat the same syringes every visit. Assessment should happen every time, not just injection. Migration can occur, but migration alone does not explain every overfilled face. Sometimes the issue is simply cumulative volume, especially when filler is repeatedly layered into the same areas. The mid-face is a common example. Small amounts may initially improve support, but repeated filling without balance can create facial widening, loss of contour, and a swollen appearance. Social media has also contributed to the problem. Patients often request trends, sharp cheeks, extreme projection, overly filled lips, without understanding long-term facial harmony. Good aesthetic medicine is not about chasing trends. It is about proportion, balance, movement, and respecting anatomy. Sometimes the best treatment is not more filler. It may be skin quality treatment, energy-based devices, collagen stimulation, weight management, or simply stopping treatment. A natural result usually comes from restraint, not excess. The goal should not be to erase every line. The goal is to create a balanced and refreshed appearance. This is why proper training matters, assessment matters, anatomy matters, and understanding aging matters. Injecting product alone is not enough. The best injectors are not the people who inject the most. They are often the people who know when not to inject. Aesthetics and Skin Institute, evidence-based education in injectables, lasers, anatomy, and aesthetic medicine. Aesthetics and Skin Institute.